strategizing through what we do. The aim today is to empower you.
In its bid to modernize public services for maximum productivity, the Yobe state government has trained top civil servants in artificial intelligence and other emerging technologies to enhance efficiency and service delivery. The state head of civil service, Tonga Bularafa, represented Governor Buni at the opening of a capacity building workshop on artificial intelligence for top civil servants in Damaturu. The workshop was organized by Biomedical Science Research and Training Center of the Yobe State University. The head of service described the occasion as historic and transformative, noting that it aligned with the state government drive to equip civil servants with modern digital competencies.
This initiative is a reflection of our collective commitment to modernizing public service and equipping our civil service and civil servants with skills, knowledge required to succeed in the digital era. It is imperative to note that this workshop was made possible by the visionary leadership of our unwavering support of His Excellency Honorable Buni, the Executive Governor of Yobe State, whose administration has always accorded top priority to innovation, science, and digital transformation across all sectors. This workshop, like several other forward-thinking initiatives, became possible due to the backing and support of Yobe State Government, for which we remain immensely very grateful and indebted. Permit me to therefore use this opportunity to urge all permanent secretaries, general managers, heads of boards and parastatals to fully participate in today's program by assimilating the insight strategies and tools shared so that we can apply them meaningfully to the day-to-day activity of our public service by paying rapt attention throughout this workshop. In conclusion, I wish to once again appreciate His Excellency Honorable Buni, the Executive Governor of Yobe State, Secretary to the State Government, BioRTC, and other distinguished facilitators for making this workshop a reality.
In his remarks, the Director of Biomedical Science Research and Training Center, Professor Mahmoud Maina, notes that the program marked the culmination of years of investing in scientific capacity building in the states.
But let me begin by expressing my profound gratitude to His Excellency, the Executive Governor of Yobe State, whose unwavering commitment to scientific innovation, to the development of this discipline in this state, is completely out of this world. His Excellency's support has been instrumental in enabling us to start these summer school activities over the last 5 years, which culminated in this artificial intelligence workshop that we are going to be having today. I also want to extend my sincere thanks to the Office of the Secretary to the State Government, under the capable leadership of Baba Malam Wali, MNI, for coordinating and sustaining these summer school activities since its inception in 2021. Obviously, this sustained investment in digital literacy and innovation has been critical in enabling Yobe State to be now a hotspot, to be now on the global map in this sphere. So I congratulate all of us here, because Yobe is indeed being talked about worldwide. BioRTC was established to be local capacity in biomedical research and scientific innovation, but our mission goes far beyond the laboratory, obviously, as you can see, because it includes applying science and technology to real-world governance challenges. With this in mind, today's workshop reflects an important extension of our work in the public service by bringing AI literacy and tools and strategies to those responsible for decision-making and resource allocation in our state.
BioRTC is one of the plethora of centers in the university that add value to the university, to the state, and the country in general. human value is very vital. And BioRTC is responsible in that aspect. There are other centers in the universities like Chronic Research Center, Desert Research Center, and many others. University as a research ground is part of the mandate of the university and is part of the philosophy of the university to conduct research for the betterment of mankind in general, and in particular Yobe State. So with this development, sir, Yobe State government is highly appreciated for its kind support. The university cannot fold its arm again without asking more. We have to ask for more. Without the support, there won't be any progress. And this workshop, AI, today the world is changing. Every day is into computer. Without computer literacy, definitely nothing can move.
Let me most respectfully request the Buni.
Participants at the workshop lauded Governor Buni's deliberate commitment in investing in modern technology to boost the workforce and change the modus operandi of the civil service in the states.
Artificial intelligence, it has come to stay. You need to move with time, and most of the administrative work that we do in the hospital, it will assist us. Basically, things like even at administrative level, like minutes of meeting, writing memos, and so on and so forth. It could also help. It will help you in that. Developing the capacity of our staff in terms of administration, be it in the main administrative department, in finance, and so on. Now, applying technology through machine learning and artificial intelligence, it will go a long way in easing our work.
I have to thank the state government for bringing the top government functionaries to undergo this workshop on AI. There is no doubt this workshop will help us in policy making, reporting, and some kind of strategic planning. If you are following our government day by day, you will come to know that the governor is a person with literacy mind. He's always making changes because changes are inevitable. Therefore, he doesn't want to see the workforce in the state left behind. That is why he organized this workshop, so that the people will be well acquainted on using artificial intelligence, which saves time, also brings the latest modernization of governance across the world. Therefore, I believe that at the end of the workshop, we will go back to our offices well prepared to pace our office work in today's contemporary world and tax.
The Yobe State healthcare sector, powered by a reform-minded governor, Honorable Mai Mala Buni CON, has been subjected to a reform process to provide a realistic and substantially meet the health needs of the growing state in line with the vision of the reform. The holistic approach has changed the face of healthcare delivery system in Yobe State. Because of Governor Mai Mala Buni's administration is indeed another signature success that surpassed all previous records in the state since its creation. The primary healthcare subsector represents the rapidly changing face of healthcare delivery in the state, concretizing commitment and reflecting the overwhelming successes of Honorable Mai Mala Buni's administration towards strengthening and sustaining inclusive and efficient healthcare coverage, which is government pledged to the people ab initio. Buni's drive towards transforming healthcare delivery in the state is occasioned by huge investment in infrastructure, equipment, and human resources, leading to the construction of comprehensive and functional primary healthcare centers, one each in the 178 wards of the state. A true testimony of healthcare delivery system right at the doorstep of the masses that need it most. That spurred up massive construction and reforms in the entire sector.
Health is wealth. Therefore, it is even an understatement to say that it is essential. It is very, very essential, and that's the reason why we embark on that. Also to bring the healthcare delivery to the doorstep of our people at the grassroots level. So alhamdulillah, we are able to achieve that.
Gabai Village is one of the beneficiaries of the One Political Ward, One Primary Healthcare Center program of the Buni administration. The facility has a large reception, a male and female medical ward, a pharmacy, an equipped laboratory, a labor room with the prerequisite equipment for taking deliveries. Others are a family planning unit, a borehole, an extended running taps, as well as staff quarters secured with a perimeter fence. Similar structures are obtained in all the 138 completed and fully operational healthcare centers in 138 of the proposed 178 political wards, with 40 others ongoing. Aisha Bulama came to the facility for medical consulting and treatment. She is happy with the services she receives.
Yanzu samun wannan asibitin a gaskiya mun yi murna sosai saboda yanzu wannan asibitin tun da aka same shi muna samun ayyukan, muna zuwa asibiti tun daga safe har dare. In ka zo za ka samu ma'aikaci, ko da suna gida ne in ka je ka buga musu kofa za su zo su duba ka, saboda muna samu suna kwana nan. A gaskiya yanzu mun fi jin daɗin asibitin nan saboda yanzu kuma akwai isasshen ma'aikata ba sa yankewa, sannan aiki ko yaushe ka zo za a maka, ko mun dare ka zo ka buga kofa za a tashi a maka aiki. A gaskiya mu yanzu mun fi jin daɗin asibitin nan.
Meanwhile, the facility manager, Mr. Musa Abubakar, says hospital attendance is improving considerably, especially now that there are staff, drugs, a laboratory, male and female wards for admission, and antenatal and postnatal services to expectant and nursing mothers.
Well, we have about 197, but recently they still come and enroll some, about 59 people. Due to the fact that in this ward we have two facilities in this ward, that's why they reduce the numbers of the enrollment. If not because of that, we have supposed to get about 130 people that will enroll on that basis, but because of that they divide it. They take the half to another facility that is Kalalawa.
In communities along Nigeria-Niger Republic border, the residents have begun to enjoy services from these facilities. Only recently, the Commissioner of Health, Dr. Mohammed Lawan Ghana, accompanied by top officials of the ministry, commissioned some of the centers in the depth of encroaching dunes in northern Yobe.
This ward called Alanjurori Ward is a ward that is located along the border of Usfari local government, which is in Yobe State. Just about 3 years ago, the people of this community had to travel as far as Niger Republic in order to access healthcare services. And this was very unacceptable. And as a result of this, His Excellency constructed this brand new facility for this ward. It is not only construction of a facility, but in addition to it, it is backed by the necessary equipment, by the human resource, with the medicines, and then of course there is also a healthcare financing mechanism under the Equity Fund program and the Basic Healthcare Provision Fund.
For these communities, the new facilities have created a huge impact by providing easy access to facilities, subsidized healthcare and quality services, putting an end to the tiresome hurdle of trekking through the sand dunes to cross over to Nigeria-Niger border to access healthcare services in Niger Republic. It is now history. The Buni administration has brought functional healthcare services to the doorsteps of the people. The State Commissioner of Health believes that the 178 primary health centers not only fulfill the campaign promise of the governor, but keys into the strategic plan of Buni's vision of a comprehensive and all-inclusive health coverage at the basic level of care.
There is no intervention that will take place without the involvement of the traditional institutions. This is in view of the need to have comprehensive primary healthcare systems, because primary healthcare is all about providing access to the people with the right technology to the people, but with the involvement of the people. And this is exactly what the government of His Excellency has done.
Additionally, the Buni administration has, at the secondary level of healthcare delivery, taken the daring step of increasing the number of specialist hospitals to complement the 2.5-decade-old Damatru Specialist Hospital that was stretched and too far for some referral patients coming from other parts of the state. The administration has rejigged and promoted 4 more facilities to specialist status, one each from the 3 senatorial zones of the state, to guarantee fair spread and easy access. The new specialist hospitals are located in Buni Yadi, Gashua, Jaidam, and Patiskum. Each facility received structural overhaul, supplies of standard medical equipment, reagents, and drugs, as well as medical staff, including consultants, in conformity with the standards befitting of specialist hospitals. To deepen and strengthen the sectoral reforms to improve access and achieve inclusion in the delivery of healthcare, 6 additional facilities were upgraded from comprehensive healthcare centers to general hospital. They include Bara, Babangida, Jaji-Maji, Machina, Yunusari, and Yusufari. Mindful of the huge challenge healthcare human resource pose for successful delivery of effective and efficient healthcare in the state, the Buni administration invested tremendously in state-owned health institutions in a bid to produce qualified nurses, midwives, and health technicians to fill the personnel gap in its facilities. Amazed by the unprecedented developments in the sector, Dr. Hamid Sume Musa, Provost of Galadima Mekari College of Health Science and Technology Nguru, describes the ongoing progress in the health sector as a revolution that is transforming healthcare delivery in the state.
When Malala Buni came on board, it is being said that there is a state of emergency in education. I know it's a state on education, but we have seen it in the health sector. Whoever comes to the state now knows that the health sector has been reformed. Look at what happened to primary care facilities. They are upgraded to secondary, some of them even to tertiary. Nowhere you go now in Yobe State without health facilities.
The college snowballed from only 2 accredited courses to achieving 10 additional courses, a feat it accomplished from 2019 to 2021. This comes through the support the institution receives from the Buni administration and staffing. The laboratories and SCT centers are cardinal to teaching and research and was adequately equipped. They include a medical health lab, community health lab, pharmacy, public health lab, medical records, and a 100-man capacity information technology center, respectively.
Within a short period of time, we started doing degree programs in many courses in the college. And I'm sure if this support by the government continues like this, we'll do more than degree in this school.
Likewise, Shehu Sule College of Nursing and Midwifery has never had it this good, as the college also enjoys great patronage from the Buni administration, especially in infrastructural development. The Buni government constructed a library of international standard at the college and expanding the administrative block and network of access roads and drains. In addition, 2 blocks of 1-story classrooms and 3 blocks of 1-story hostel accommodation were built.
This institution have witnessed a robust intervention, both in terms of human and non-human infrastructure. Let me talk about the issue of infrastructure. When we assumed office, virtually this institution was battling with very few infrastructures, particularly hostel accommodation and classes. And we all know that this will determine the type of accreditation you will be granted from the regulatory body. So this administration from 2019, when His Excellency visited this institution, let me quote you to say that he was the first sitting governor to visit the institution, to sit down and attend a program, the graduation ceremony. We laid our complaint and he listened to us, and then he granted approval. First and foremost, the construction of the one and ever story building. This is the only story building we have in the institution, which is holding about 200 bed capacity.
The combined support of the state government and the dedication of the college authority have in the past 3 years resulted in 100% success in students' final examinations. And this year, the college got the council's nod to commence higher national diploma in nursing and midwifery. Lecturers are also sponsored by the government to further their education. The regime also places student doctors, nurses, and midwives on a monthly stipend to encourage them in their studies. The government provided automatic employment to over 300 graduates of the College of Nursing and Midwifery and 172 graduates of the College of Health Science and Technology.
We are now giving employments, giving support, and at the same time sponsoring students, especially from the difficult areas where we established those primary health centers. We used to give employment to students who are from that community, for them to be properly trained to go and man also the primary health centers, which is also yielding a positive result.
The obstetrics and gynecology wing of the complex has 64 open cubicles, 5 call duty rooms, 5 satellite pharmacies, 1 side laboratory, and 4 nursing stations. The special baby care unit has 3 adjoining generously spacious and nicely done wards that include 28 baby cot wards for newborn babies suspected of sepsis, 10 newborn cot wards for outborn babies, and 10 newborn baby cot wards for inborn babies, 4 nursing stations, 10 bed space room or unit for their nursing mothers. In addition, there is a 10-bed space room for nursing mothers to breastfeed their newborn babies, 5 doctors' rest or call duty rooms, 5 nurses' rest or change rooms, 5 offices for the unit matron in charge, 4 additional offices for health information management and documentation, seminar room, a library with kitchen and stores. The labor ward and obstetrics theater units have provision for 4 operation suite rooms, including attached sterilization and scrubbing area, 6 recovery rooms, additional offices for anesthetics, perioperative nurses, other theater support staff, male and female change rooms, common room for staff on duty, seminar and computer rooms. The pediatric medical ward has 40 cubicles, 4 call rooms, 4 side labs, and satellite pharmacies. Similarly, the emergency pediatric unit has 32 bed space cubicles, including a resuscitation cubicle, 2 doctors' call duty rooms, a side laboratory, a nurse's station, a change room, a satellite pharmacy, and 8 staff offices. The complex is being equipped with state-of-the-art machines to provide all the necessary healthcare services to mother and child to effectively curb the menace of maternal and child mortality in the state. There is no doubt that this ambitious project, which is about to be commissioned, will be the largest maternal, newborn, and child healthcare complex in Nigeria. Beyond providing access to healthcare facilities, subsidizing healthcare, and ensuring inclusion in healthcare coverage, Buni's vision is to put a stop to the unacceptable rate of maternal and under 5 children mortality in the state. The mouth-watering subsidies in the administration of healthcare offered by the Yobe state government are attracting medical tourists to the state. To Elijah Adamu Hashiru, a retired permanent secretary from Bauchi State who was to travel to Egypt to seek medical service to his ailing child but was referred by his neighbor to go to Yobe State Teaching Hospital, the services provided by the institution was truly revolutionary. After 2 successful surgery operations, the retired permanent secretary could not hide his joy that he obtained the required services at the Yobe Teaching Hospital at a very minimal cost compared to what would have cost him if he had traveled to Egypt. He was full of gratitude to the Yobe State government for investing in the health sector and providing the needed services to the people. He called on all the state governments to emulate Governor Buni's revolution in the health sector.
Wani abun farin ciki da na ji a wannan asibitin shine dialysis da kuke wa mutane is free. Har ina cewa ko kudin kati ba a karba, aka ce hatta paracetamol in kana da zazzabi kana kan gadon dialysis free da a maka. To gaskiya wannan gwamnati ce mai adalci, kuma muna addu'a yadda wannan gwamnan yake yi, Allah ubangiji ya sa sauran gwamnoni na wannan shiya su ma su yi copyright da abinda wannan gwamna yake wa talakawansa.
As for Yobe indigents, hundreds of thousands of children under 5 years, the elderly and vulnerable persons are enjoying free medical services such as the free drug program, social equity and basic health care scheme program under the Yobe State Contributory Health Scheme introduced by Governor Buni. The excellent healthcare services provided by the Yobe State government at almost no cost have made healthcare delivery in the state very amazing, affordable, and accessible. Surely, Buni is working and Yobe State is moving.